Now to the state of America's health. The Make America Healthy Again Commission releasing its highly anticipated report last week with a big focus on childhood chronic disease. Let's bring in the commissioner of the FDA, Dr. Marty Makary. It's great to have you with us. A lot of findings in that report that are shining a light on disease in this country, not just for everybody, but children specifically. Can we talk about some of the reform that you want to implement to help make us healthier?
Absolutely, Jackie. You know, scientists have been waving the flag for years, saying you've got to look at this body of scientific data. And the modern medical establishment really has been disconnected. We've been so busy focusing on treatment, on billing and coding in a high throughput model. We've got to stop and ask ourselves, should we be focusing more on school lunch programs, not just putting every kid on Ozempic? We've got to talk about food as medicine and gut health and the microbiome. We've got to talk about environmental toxins that cause cancer, not just the chemo to treat it. And maybe we need to treat more diabetes with cooking classes, not just throwing insulin at people. And this report is a fresh new approach that really calls for a transformation of our healthcare system from a reactionary system to a proactive system. So I could not be more excited about this report. There are no sacred cows. It talks about 70% of the diet being ultra-processed. It talks about pesticides, microplastics, natural light exposure in children, sleep quality. Remember, Republican, Democrat, and independent moms showed up in high numbers to vote for President Trump over this very issue.
Yeah, and Dr. Makary, as you know, I'm a cancer survivor. So after that experience, I dug into the gut and the microbiome and the chemicals and the issues that can impact that potentially for people. So I am with you. But at the same time, covering business for so long, I also know that food is a big industry. There are many lobbyists out there in Washington that are fighting to keep everything just the way it is. How do you combat that?
You know, this is a purely independent scientific report on the state of health in America. And when we talk about payment reform, we're really talking about how we fund our broken healthcare system. This report talks about how we fix our broken healthcare system by getting at the root causes and the ultimate issue that we've not been talking about, and that is the health of the population. When you have 40% of our nation's children with a chronic disease, that portends for a very expensive future healthcare system. We can address it. There are many things that we can do, even at the FDA, addressing food, which many people forget is the first letter of the FDA is food. It's not just drugs.
Right. Let's switch gears for a moment, because you just wrote in the New England Journal of Medicine about an evidence-based approach to COVID-19 vaccination, that there should be a new framework for how we look at this, especially for young children. And this is after that new Senate report came out alleging that under Joe Biden, top officials took steps to actually delay warning the public in 2021 about potential risks of heart-related complications from receiving an mRNA vaccine. How are you looking to shake things up at this point in time?
Well, Jackie, that was very disappointing when we learned that people at the FDA had hid from the public the myocarditis complication from the COVID vaccine in young men, and that the incidence is much higher than previously recognized. And so we're making a change to the label, but in a much bigger step, we're basically saying the day of rubber stamping COVID vaccines for young, healthy kids is over. You cannot send us an application for a new COVID booster each year with no new updated clinical trial data and expect the FDA just to blindly rubber stamp it. So in this New England Journal of Medicine article, Dr. Prasad and I basically said we've got a new framework because people don't trust us. You know, 15% of healthcare workers got the booster last season, and even fewer parents got the booster for their kids. So we've got to reevaluate this and use an evidence-based approach and common sense.
I want to ask you about the pricing on prescription drugs. The president with an executive order out on that. I did not really understand the intricacies involved and how it works with each country. But when you really take a step back and listen to what the president is saying, he's saying that once again, Americans are being ripped off, and he's going to put a stop to that. Your thoughts?
Well, look, the president does not like it when Americans are getting massively ripped off. And this has been one of the great American ripoffs. We're paying 3, 5, 10 times more for the exact same pill sold in London or Germany or France. And so the president is calling out the companies, and more so, he's calling out the other countries that negotiated these sweetheart deals with companies and has said, look, we're the biggest purchaser of these medications. We want the most favored pricing. And it's going to happen. I mean, we're not going to see a 1 or 2% reduction. I think we're going to see a massive reduction quickly. That's because we're using every carrot and stick we can to try to move this along and negotiate better prices for Americans. Remember, pharmaceutical companies spend about 15 to 20% of their revenue on research and development. And they spend more on these marketing and advertising and commercials where everybody's singing and dancing. And so we can actually work with these companies so that they can continue to thrive, do research and development, but so that we're not paying the entire bill. Other countries are paying their fair share.
Right. And I'll also make the point that is relevant to the previous conversation we were having. Those savings on prescription drugs will also benefit Medicare and Medicaid to bring those costs down, too, which is beneficial. Dr. Marty Makary, great to see you. Thank you.
I'm Steve Ducey.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.